Well, good afternoon, everyone, and thank you for joining us today. Today's case numbers continue to show what we are doing in this province is working. Together, we are flattening the curve and we are reducing the spread of COVID-19. Today, there are 2 new cases and there are 14 new recoveries. That means that nearly 60% of the people who contracted COVID-19 in Saskatchewan have now fully recovered. It also means that the number of active cases in Saskatchewan is now 118, the lowest number of active cases since March the 27th. Now, none of this is a reason for complacency, but it is a reason for cautious optimism. And it means that we can start to think about what the process of reopening Saskatchewan will look like. But let me be clear, there is no magic switch. That we can flip that sends everything back to normal overnight. When we do begin to lift restrictions and reopen businesses and begin public venues, it will be done cautiously, it will be done methodically and gradually. And businesses will be expected to maintain good physical distancing and good cleaning practices to keep their employees as well as their customers safe. And we will be working in developing our Reopen Saskatchewan plan throughout this week in close consultation with Dr. Shahab. And I expect to release it at some point next week if our case numbers continue to hold steady where they are. As we begin to reopen, testing and contact tracing will become even more important. We have been increasing our number of tests and testing capacity over the course of the recent days by deploying Gen Expert testing machines to a number of locations throughout the province. These units provide results on location in under 4 hours, without the swabs having to be submitted to the Roy Romano Provincial Lab. One of these units is already up and operating in Meadow Lake, and another will be up and running in Prince Albert tomorrow. And the units will be provided to about a dozen additional communities throughout the province in the days ahead. This should help us achieve our goal of 1,500 tests per day by the end of the month. The SHA has also ordered the new Spartan Biosciences testing equipment that has just been approved by Health Canada, and together with the kits to do a further 25,000 tests. And we will be increasing this order over the coming weeks. Also, Saskatchewan is anticipating an allocation of about 46,000 additional Spartan tests from the federal government's collective order. Together, these measures will greatly increase our testing capacity in the province. This morning, Canada's Chief Public Health Officer, Dr. Tam, said that about half of the COVID-19 deaths in Canada have been related to outbreaks at long-term care facilities. Now, we have been fortunate in Saskatchewan so far as we have avoided any major outbreaks in our long-term care facilities. And we need to do everything possible to keep COVID-19 out of our long-term care facilities as well as our other healthcare facilities. To this end, the Saskatchewan Health Authority will be implementing even more stringent policies, including continuous masking of our staff in long-term care facilities as well as our acute care facilities. We'll have mandatory healthcare screening, which will include temperature checks, both pre and post-shift. And the Saskatchewan Health Authority is finalizing its procedures to minimize staff movement between our facilities. And I also want to mention that the online application for the Saskatchewan Small Business Emergency Payment Program is now live as of today. If you have a business that has had to close, or you have a business that has had to significantly curtail its operations as a result of the COVID-19 restrictions, you can apply online by going to the business page of the COVID-19 portal on the Saskatchewan government website, saskatchewan.ca. And finally, I want to thank everyone for observing the physical distancing rules and guidelines over the Easter weekend. It was a very different Easter for many of us, virtually for all of us. Not attending Good Friday or Easter Sunday church services in person was different for me, and I'm sure it was different for many across the province. The absence of large in-person family dinners. So once again, I want to thank the people of Saskatchewan for doing what you are doing, the sacrifices that you are making to reduce the spread of COVID-19. And let me say what you are doing, it's working here in Saskatchewan. You are protecting your family. You are protecting your friends. You are protecting your neighbors and your community. And by doing so, you are saving lives in our province. Thank you very much, Dr. Shahab.
Thank you, Premier. So I'll just maybe emphasize a few key points further to the Premier's remarks. The first is that of the 300 cases in the province, 131 are travel-related. Another 120 are either close contacts of cases or linked to mass gatherings, which now are becoming very uncommon. 27 are individuals who have no known exposure, so not a close contact to a known case, so no history of travel or attendance at a mass event. And 22 are under investigation. So as you can see, most investigations are being completed through the diligent work of public health staff throughout the province. I also want to flag that we continue to have obviously cases in individuals who work in essential services, 33 cases in healthcare workers, 11 plus were due to social events, but certainly we can see and expect over time, occasional cases in healthcare workers. Transmission doesn't seem to happen when appropriate PPE is used, but does seem to happen when there isn't use of appropriate PPE or through healthcare worker to healthcare worker transmission in settings where PPE may not be required. So again, I just want to emphasize that while all of us are staying home, healthcare workers are moving forward and working in many facilities in some cases. So obviously any steps that can mitigate risk to themselves and to patients and residents is going to be very important in the coming days. And the same applies to essential workers, like as essential work continues, including farming. There are means by which you can minimize the risk of transmission within a essential work environment. Those of us who go shopping see that happening very evidently in terms of how we line up and the plexiglass barriers and other kind of measures. Similar processes are being used in other essential workplaces. So it's just, all of us need to recognize and support healthcare workers, others who are moving forward and actually working to support essential work, which includes healthcare, food security, other areas, farming. But at the same time, like the Premier said, continue to practice physical distancing, staying home as much as possible, to continue to have a flat curve for the next little while. Thank you.
Thank you. We now have about 25 minutes for questions.
Managing the infection rate, if you will, so that our healthcare system can handle what is coming at it in the weeks, months, and ultimately however long until we hopefully have a vaccine for this disease. So I'll let Dr. Shahab speak to some specifics, but no absolute metrics as opposed to seeing a number of days or maybe a couple of weeks of steady numbers.
Thanks, and I think what I would like to add is that obviously the exposure categories are really important because while we expect to see cases from international travel, the volume has gone down significantly. And while we occasionally do expect to see cases in close household contacts, we need to continue to understand how we can further minimize transmission in those settings where people are self-managing very successfully for the vast majority at home. Secondly, for essential work, we need to again continue to increase our understanding what are the factors that result in transmission in the healthcare environment and other essential workplaces, because as we learn more about that, we can minimize transmission in those settings for current essential workplaces, but also in future as the criteria for workplaces changes. Just use that knowledge to further guide transmission. But then, of course, we understand that, unfortunately, in many parts of Canada, a lot of the transmission is within long-term care facilities. So while that's very tragic and very concerning, and we need to do everything that we can to prevent that, that is a transmission that happens within a certain context, which is very hard to manage, but it's not the same as transmission that happens in other essential workplaces, for example, or in the community. So understanding these factors is important. And this is really driven by testing on the one hand, and the detailed contact tracing that happens where public health staff interview a case and their contacts. That detailed contact tracing is critical to make sure that patients isolate, their close contacts isolate to break the chain of transmission. But the information from that is critical to understanding how transmission continues to happen.
Do you have a follow-up, Mark?
How important is testing to reopening, and how important will the Spartan tests and the Gen X testing machines be to reopen the province?
I'll just approach that, and then Dr. Shahab may have something to add. It's of vital importance, alongside with the contact tracing. The number of tests that we need to have the capability to perform as we reopen portions of our economy in the next while. We need to address where some of the opportunities for this disease to spread, where those are, and concentrate our testing not only into the areas that we have thus far, but also into those areas where there may be some opportunities for spread. So the number of tests and the ability to go higher with our tests as we start to reopen the economy is paramount and goes hand in hand with the contact tracing that we are going to do. And listen, it will be a phased approach, a methodical approach when we get to this point in time where we will open up a portion of the economy and then test and contact trace and identify how our numbers have changed, if they have changed. If they do not change or change very little, then we would look at a second phase, and then again sit and test and contact trace and see what impact that has on our economy. And so we are identifying which areas would be lowest risk for us to move on in the early days. And then there are also some other areas where we may not be able to move on for a number of months or until ultimately we get a vaccine. And, you know, first among those that come to mind is our long-term care centers, where you are seeing today we are actually increasing the protection in and around our long-term care centers with our staff and even with visitors. Understanding that isn't going to be the place where restrictions will be removed anytime in the near future. Those are long-term care centers, personal care homes. Those are areas where we need to continue to be vigilant for quite some time now, protecting our residents of those centers. Anything to add, Dr. Shah?
I think, like the Premier said, the testing criteria will continue to be refined to focus on, for example, if there's a new exposure category in terms of maybe certain businesses reopening with certain change criteria. Again, I have to stress that even if we go back to work, it will not be going back to work as usual. It will be going back to work in a very different way for the next little while. So focusing on that, and obviously the testing criteria already stress, investigating clusters and outbreaks, whether they're in an institutional setting or in the community. So in those settings, testing is done much more widely, just to catch a cluster and try to address that. And that's happened already in many essential workplaces as well.
We'll take our next question from the room. Karen?
Today's news release described farms as essential workplaces. Am I reading too much into that word essential? I think it was in the allowable business category before. I'm just wondering if anything has changed or if that means anything.
I'm not sure exactly why the word essential workplace was chosen. It wasn't, this is an allowable business, but I would also say that it is actually an essential business. As we look at the wants and needs of society, food most certainly ranks among the needs. We are an agricultural superpower here in Saskatchewan in not only the food that we produce, but in the products that we produce that are part of the supply chain of the agriculture industry, not just here in North America, but around the world. And I'm thinking of potash fertilizer. I'm thinking of the zero-till drills that we produce in numerous manufacturing facilities here in Saskatchewan. Saskatchewan traditionally has been a superpower in food production, but I would say today that we are most certainly integrated up and down the supply chain of agriculture, from equipment to fertilizer to research, and all of that is imperative, not just for food production here in the province, but food production worldwide. So it is an essential service. We are making every effort to ensure that the supply chain is open, not only for Saskatchewan farmers, but for Canadian farmers and farmers around the world. We've been there from day one with these restrictions, and today is a reminder that we have an industry that is locally going to become more active in the next couple of months with seeding starting to happen. And this is an area that we may keep an eye on, if you will, with our testing and our contact tracing to ensure that we are making every effort to protect our ag producers and those that are working in the industry that is the spinal cord of the Saskatchewan economy.
You have a follow-up, Karen?
You mentioned that people are largely complying. Social media this weekend was full of reports of large family gatherings and such. Have you heard about that or seen any evidence of large family gatherings that could lead to more positive cases?
No, I have not seen those. First, let me say that those weren't at my place, as my wife and I had Easter dinner together multiple times this weekend, as you can tell by the size of me. But no, I have not heard directly of that. In fact, my wife and I also had the opportunity to go on a number of walks outdoors this weekend, and I was actually pleasantly impressed and surprised with the adherence to the physical distancing measures that have been put in place. As I saw, families that are in the same household were enjoying their Easter dinner. Families that are not from the same household were not gathering together. Now, this is new and different for us. In particular, I would say in Saskatchewan to not come together at these times of family celebration and religious celebration, quite frankly, times like Easter and Ramadan and Passover. But I would just once again say thank you to the people of the province for the physical distancing measures that they are, from what I appear to see, adhering to. For those that are not, I would ask them to give that pause and give second thought, as it may not be you that is in the high-risk category, but it may be your mother, your father, it may be an aunt, an uncle, it may be your neighbor's aunt, uncle, mother, or father. It is no secret with this disease who is most at risk, and it is those with underlying health conditions, and it is our community's most elderly. And we owe it to them to not spread this disease unwillingly to their generation.
We'll take our next question from the phone lines. Operator?
We have Phil Tank with the Star Phoenix.
Yeah, I'm sure you've heard the stories about the nurse who tested positive after treating patients in Stony Rapids. I'm just wondering if you could speak to that and whether there's any plans for more personal protective equipment or testing kits up in the north.
Thanks. I'll make some initial remarks and then maybe ask Dr. Zayed and Scott Livingstone to add to that. So, like I mentioned earlier, we have to respect the individual privacy of healthcare workers. Like I said, they are stepping forward while everyone else is staying home. And we need to understand that, while the expectations are many from healthcare workers to work several shifts in several facilities, and it's a very challenging environment for them in terms of risk at work, going back to the families, and the SHA already has taken significant steps to support healthcare workers through appropriate PPE and training and limiting movement as much as possible within facilities where that's possible. But having said that, obviously, we understand that it's an ongoing risk in terms of healthcare workers getting exposed in those settings, and also a risk to patients and residents. So with that, I'll ask Dr. Zayed to speak to the investigation that happened over the long weekend, and then afterwards, Scott Livingstone to add comments on that as well.
So I just thank you, Dr. Shahab, for this. I just want to emphasize two things: that the screening protocols for healthcare workers in Athabasca Health Authority and the North is no different than those being utilized elsewhere in the healthcare system. And if a healthcare worker goes through the screening and they start to show symptoms at work, whether in the North or anywhere else, they need to isolate and be tested. For our contact tracing, the contact tracing, I'm very quite confident of our contact tracing process. We are able to identify individuals who might have been exposed and asked to isolate and monitor for symptoms. Testing is done and as needed, and I think everything is going as controlled, and we are not really considering any person who has been might have been exposed has been contacted. So we are really monitoring the situation very well.
So the only thing I'd like to add is, as the Premier and Dr. Shahab have already pointed out, healthcare workers are that group of folks in this province that go to work each and every day to take care of others and are at some of the highest risks of contracting COVID-19, even with precautions in place. But also to the Premier's point and Dr. Shahab's point earlier, we are expanding this week healthcare workforce screening across all of our facilities, and our partner at the Athabasca Health Authority, which has been following the exact same process we have, will do the same, as well as the continuous mask initiative as well, which the Premier also announced, which will also help support and protect folks from asymptomatic spread in our facilities, where we have folks in all our care areas wearing masks continuously, and that will begin again this week.
Do you have a follow-up, Phil?
Yeah, you may have seen a story from ESPN that Saskatoon has been mentioned as one of the possible locations for a neutral site NHL playoff games, presumably without fans. I'm just wondering, from especially Dr. Shahab's perspective, what would have to happen for something like that to be pulled up, and what is your feeling just hearing about that?
So actually, I may not have seen that particular story, but I think, first of all, what are some of the steps for going back to work, I think, are important in terms of what's important work that needs to either already happen, quote unquote essential work, but then what are some other opportunities to start work or other activities that are important for society to function. I think that has to be done in a stepwise fashion. And like I said earlier, even going back to work, at some point over the next weeks to months, will still mean going back to work in a very different way. So from that context, I think large group events would probably be, lower in terms of business as usual. But having said that, I think we've already learned from over this long weekend, there are many creative, inventive ways to stay connected while staying apart, either as individuals or as part of events. And I think that's something that possibly may be an opportunity for some of these things in the medium to long-term future.
I would add to that, Phil. I wasn't aware of that announcement either. I should be likely, but I would trust that if any event like that is taking place, whether it be in Saskatoon or across Canada, that the Chief Public Health Medical Officers of not only the respective province but the nation would be involved, ensuring that all of the safety measures are in place with any event such as a hockey game. And I'd just close that question with if that is going to occur and they are able to meet all of the criteria of Dr. Shahab's and Dr. Tam's, that I would hope that the Edmonton Oilers would be playing, quite frankly, and so that we could all cheer for them, in particular, as there are many Oilers fans from my part of the province. To your first question, the personal protection equipment, into the next number of weeks, the foreseeable future, the Saskatchewan Health Authority, the Ministry of Health have worked very closely with our federal partners, as well as been quite well prepared with respect to personal protection equipment, as we have a number of weeks of supply, ensuring that our healthcare workers that are going to work each and every day are protected as best as we possibly can. And I think that is irrespective of whether you're in the north or the south or where you may be working. And today's announcements are further identification of with respect to continuous masking and some of the healthcare screening pre-shift and including temperature checks is a testament to the efforts of not only the Saskatchewan Health Authority but the individuals working within the Saskatchewan Health Authority to ensure that they are taking every precaution possible in not spreading this disease, in particular in our long-term care centers and our acute care facilities, but any of our healthcare facilities across the province. On the testing availability, we do have the ability to continue to ramp up our testing as we are bringing on rapid access testing machines as well as other machines in our communities. And that is all in an intent to ensure that we have the availability or the ability to increase our testing when we start to open up some of our restrictions and to follow that up with some of the most aggressive contact tracing in the nation. This is the way that we can protect the people, in particular those people most at risk of contracting the most severe symptoms from this disease as we begin to minimize the economic impact and reopen our economy. And I would just say that when you dial 811 and may get a referral for a test, that doesn't, it makes no difference whether you are calling from Wollaston Lake, La Loche, or whether you're calling from Regina or Moose Jaw. The answer is the same across the province, and the availability of testing will get better in our rural and remote communities as we go through the next number of weeks and expand our ability to have some not quite mobile testing units, but some rapid access testing units that will be available in communities right across Saskatchewan. So we're working very hard on this to up our accessibility and our ability to test in numbers in the weeks ahead.
We'll take our next question from the line, operator.
We have Lisa Schick with CJME.
Hi. You've spoken about this a little bit regarding testing and, like you just said, ramping up testing. You've also talked about the goal by the end of the month being about 1,500 tests a day. I'm just wondering, is that going to be enough to get the kind of data you're going to need to know whether you can open up the economy, or are you going to need to expand that goal further?
I think that is the target for the end of the month. As new testing abilities come on stream, there's nothing preventing us from going beyond that in the weeks following. But most certainly, that is the target to achieve by the end of the month. Now, in saying that, the parameters at which we test individuals, we don't just test whoever calls in. There is a criteria to go through to be referred for a test. And so, you know, as we're seeing with the very positive numbers from the very effective physical distancing that's happening in the province, the testing numbers have increased. We're up around 1,000 a day, maybe down a little bit yesterday, but up around 1,000 a day the last number of days, and with a goal to get to 1,500. But we really need that testing capacity, and this is most important, is that we need that testing capacity to be at 1,500 or even beyond that in the weeks after we are able to reopen the economy, should we have a local flare-up, if you will, so that we can move in and isolate any flare-ups that occur and ensure that we contain it to a local facility, a local community, a local portion of a community, and contain this disease as best we can as we go through the next number of months. So the goal is to reopen our economy, have the most vigorous testing program, if not the most, one of the most in the nation, followed up by one of the most vigorous contact tracing programs in the nation, and to open up our economy to a degree where we can manage the positive IDs in the province, so our healthcare system can manage the people that may require care from this, and so that we can absolutely minimize the fatalities that are coming from COVID-19 in Saskatchewan. We feel we are on a path to do that, and we thank the people of the province for getting us into a position where we can even have this conversation by practicing the physical distancing measures that we've had in place now for almost a month.
You have a follow-up, Lisa?
Yeah, the 1,500 though, is that going to be enough to be able to get the data you need to know if you can start opening up the economy, or are you going to have to make that goal higher, up to 2,000 or 2,500, to be able to have that information?
Yeah. So in addition to testing numbers is, who you test and why you're testing and what do you do with that information. So, we've talked in the past briefly about the R0 concept. So, the part of testing and then doing contact tracing and following up not just the case but the contacts is to understand, is further transmission happening. So, in the past we did see, and we continue to see that for the vast majority of cases, the R0 is less than 1. And that is what we need to keep the curve flat and extinguish the outbreak, because a person tests positive because they traveled or they were exposed in the community, they self-isolate immediately at home, away from household members as well as much as possible. There's no further transmission. That is what you want to see, even if someone was exposed in a work setting or an essential workplace or a healthcare setting. You want to see that curve flattened by no further transmission. We also know that unfortunately when there's group events, the transmission can be pretty high. One person can infect 5, 10, 15 more people. So you want to minimize those opportunities going forward. Even as business comes back to normal, you still want to minimize that exposure to multiple people by better understanding transmission dynamics. So we already understand that much better in healthcare. We understand that much better in terms of even when you're at work, even the socialization that happens at work is a high risk for transmission. So minimizing that even at work, that physical distancing has to maintain, not sharing food items or multiple touch surfaces, attention to hygiene and disinfection of multi-touch surfaces. So that continues to be important even in the work setting. And as we move forward, while recognizing that sometimes you can have significant outbreaks in long-term care settings or other institutional settings, you still want to aspire to keep that transmission that are not as low as possible. If you keep it less than 1, the outbreak will get extinguished. If you keep it less than 2, you will still have a curve which will be lower and more manageable. And obviously, you want to do everything you can to have it higher than 2.4, which was which was the midterm scenarios in the models.
We have time for one last question from the line, operator.
We have Roberta Bell with Global.
Hi, I just had a question regarding whether or not it may be too early to be making these considerations. We've heard from some other provinces and from Dr. Tam that we could potentially see a second wave over the coming months, or if people get complacent, that's when stuff could start to spread.
So I would maybe just start with, no one should read anything into our comments about opening up in phases some areas of our economy with being complacent. Nothing could be further from the truth. When we talk about our testing and contact tracing regime being among the most vigorous in the country, we're very serious about that. And this maybe I would address a little bit of Lisa's second question as well. Dr. Shahab had talked about two items that we're looking at, that Dr. Shahab is looking at, and collectively the government is. One is the volume of positive cases, and 2 is the exposure category of those cases. What this vigorous testing and contact tracing program will do is as we relax these restrictions, not all at once, but in phases, and test and contact trace to understand what the impact of that relaxation may or may not be. The whole goal is to identify, with a vigorous testing and contact tracing program, is to identify any outbreaks as they occur, and then to contain that exposure to wherever it is. And this is how we would be able to actually manage the infection rate, if you will, of COVID-19 across the province. So in no way is the plan that we are starting to discuss complacent. In no way is it going to be in place tomorrow. But it is, we feel that if we are going to at some point start to relax some of the restrictions in our economy, understanding that the expectation is that people will still practice very prudent social distancing, physical distancing, to ensure the lack of spread of this disease, that we have a very, very comprehensive and robust testing and contact tracing plan in place to ensure that we can contain any outbreaks and protect the people of this province.
Do you have a follow-up, Roberta?
What would you say to people who might be seeing these positive numbers and thinking that, everything's working and they can go back to life as it was before? What message would you have for those people?
We are seeing these, and Dr. Shahab, if you'd like to add to this when I'm finished, but we are seeing these positive numbers because of the very stringent physical distancing measures that people, individuals, families are taking. We are seeing these positive numbers because of the restrictions with respect to the size of gatherings, and we have seen what happens when you don't have those restrictions with a skidoo rally and a curling bonspiel. The infection rates can skyrocket. So we are seeing these numbers due to the restrictions that are in place. And as we move forward through the weeks and months ahead, we are hopeful that we can continue to see what we feel is a flattening of the curve and be able to start to reopen areas and sectors of our economy, but only doing so with a very robust testing and contact tracing program in place so that we can manage the infection rate and thereby do minimal damage to the economy here in Saskatchewan. Anything to add, Doctor?
And that concludes our time for today. Thanks very much, everyone.